After 30 years of being trapped by pain, I finally broke through using the latest science based strategies. And I'm here now to present to you the same strategies that helped me feel better and at no cost, and there's no catch. Greetings. It's nice to see you again. Today we're going to be talking about courage. I know if you're viewing this show, you obviously must be dealing with chronic pain. Now, have you ever considered how much courage it takes for you to meet that head on, that to keep going to your appointments, trying to find information, dealing with setbacks, dealing with all the challenges that come your way? Well, I've thought a lot about courage, and I believe each one of you viewing this has a lot of courage. You know, even doing something like repeatedly going to your physical therapist and going through the challenging physical therapy appointments, that takes courage. It takes courage to lie in the middle of the night wondering what's tomorrow going to bring and still getting up in the next morning and facing the day. That takes courage. It takes courage to explain to your loved ones and friends that you can't do the same things you used to do before you've got your chronic pain situation going on. It takes courage to pick yourself up again after a medication or a treatment modality failed to help change your level of comfort. And it takes courage to click the button to watch a show like this, to hear somebody else giving you ideas to help you feel better. And it takes courage to believe in what I'm saying and what other people are saying. So I want to salute the fact that you do have courage. And not only do you have courage, but you have resilience. Because resilience means you're picking yourself up and you're showing up, doing all the kinds of treatments you're hearing about, researching, even going on Dr. Google, finding out terminology and other ideas, and just never giving up on yourself. That takes a tremendous amount of courage. The other thing that I would like to talk about is there's vulnerability in sharing. To talk to people and say, well, my life is not the way I wanted it to be, and I'm still in process trying to find levels of comfort. And hopefully, yes, one day, all of this will be behind me. And I wish that for you. I wish it for anybody who has chronic pain. But sometimes the reality is you're going to have to shift how you're living to understand how you can cope better and have more comfort in your life. So if you don't view chronic pain like strep throat, where you get a regimen of antibiotics and it disappears, which is great, and you pick yourself up and go on and don't even look back, chronic pain is different. And as you know, chronic pain exists after the acute phase of pain. All the pathology has healed, the broken bone that was injured has mended, and now you're in that chronic pain phase. And I call that, one term is the no man's phase. No man wants to be there. If you're in war and the injured and the mortally wounded are left in no man's land, and some doctors look at chronic pain patients and say, I don't want to go there. I don't want to have to deal with that disappointment because as a physician, I'm trained to heal or cure. And when I see a chronic pain patient coming my way, I know it's going to be frustrating. Well, that's very true. And what the doctors don't know what it's like, but you do know how it is to live with that. The fact that triumph over pain may not be available to you in the moment or the next week or next month, but it's going to be a journey, one step at a time. Like I say, unwinding pain, finding those things that are going to turn down the pain volume, of alleviating yourself from those kinds of things that amplify your pain, such as tremendous stress. So is courageous to learn stress management skills, not just sit and listen to, oh, mindfulness is nice and, oh, maybe you should meditate. No, it means practice things that make you feel calmer, practice things that really do make a difference in your life. Not that it has a label like this person did this breathing or this person did this journaling and it just changed their life. It's to find those things that are going to make a difference in your life. You know, it's unique. I always say you're an experiment of one. What works for a friend of yours who had the same condition may not work for you, but what works for you may not work for 5 other people. So again, I'm going to go back to the C word of courageous. It takes courage, and I know that you have it, and I believe in you. And if you keep coming back to this channel, you're going to hear more and more ideas that are going to help you inflate your sense of courage and resilience. And that's what I have to say today is that I believe in you and you have a courageous heart. So take care, and it's bye for now. I hope you enjoyed the video. And if you found it useful, please give it a thumbs up. And also, please subscribe so you'll be given notice when the next video is uploaded. And also, to go an extra step, how about leaving me a comment so I know I'm not out here all alone trying to help people?